My name is Tiana Rogers. I'm a student nurse at the University of Manitoba, and I'm going to be doing a subcut injection video. So we'll look at our scenario. So we have scenario A, we're giving hydromorphone subcut. It's currently March 10th, 2022. The time is 20:15, and Jake Nursing's having pain and dyspnea related to end-of-life treatment for cancer. So we'll look at our MAR. I see our patient's nursing Jake. The FIN is 312-654-987. Date of birth is January 1st, 1960, and our doctor is Dr. Skills Lab. There's no allergies for our patient here listed, and it's important to make sure it's been double signed by a transcriber and a nurse because we don't have our doctor's orders, so that way we know that part of the first med check has been completed by verifying those signatures. So I see that we can continue with this med because it's been signed by the transcriber and nurse. We're giving hydromorphone, 2 milligrams, subcut. BID, we have our two time frames. It's March 10th, the year is 2022, and we're giving for 2030 time frame as it was given this morning for 8:30. We also need to look at the parenteral drug monograph. So we have hydromorphone. It's an opioid analgesic. It can be administered by a student nurse. It's a high alert medication, so restrictions do apply, and two nurses do need to verify the dose and volume before giving this drug to the patient. It can be given through the subcut route for chronic pain and palliative care. The safe dosing range is 1 to 4 milligrams. We're giving 2 milligrams, so we know that's safe, and every 4 to 6 hours as necessary. Our two time frames were further apart than that, so we know we're okay to continue with this medication. And some potential hazards are respiratory depression, hypotension, bradycardia, dizziness, confusion, nausea, vomiting. So we'll make sure we inform our patient when we head into the patient's room. So we'll go back to our MAR. We'll begin to select the correct medication and supplies. So we'll do hand hygiene. We'll select the correct med from the narcotic bin. So we have hydromorphone. 2 milligrams is our dose. The concentration is 2 milligrams per ml. So we'll make sure we drop 1 ml in our needle and syringe. It's subcut, and I see here is SC for subcut, and it's given BID. We have our two time frames. It's March 10th, the year is 2022, and we're giving for the 2030 time frame. We also want to make sure this drug has not expired, so I'm going to look for an expiry date, and I see it here. It has not expired yet, so we're okay to continue with this medication. The supplies that we'll need is a 3 ml syringe. We'll need a blunt-filled needle and a 25 gauge by 5/8 of an inch injection needle. So we'll do hand hygiene again, and we do need an alcohol swab. We're going to swab the top of the vial for 30 seconds. Okay, so it's been 30 seconds. We can throw the swab in the garbage. And we'll open up our supplies. We want to peel it backwards to remain sterility. So peel it back like that. You can take it out. And we want to do the same for our blunt-filled needle, just pulling it back. And then we can attach the two. So because our volume is 1 ml that we need, we first need to instill the 1 ml of air into the vial. Now we can work on drawing up our medication. So we have 1 ml. We'll use the scoop method to recap. And then we can knock out any bubbles. Okay, so I want to verify the volume. Okay, and before we change to our injection needle, we'll want to pull back completely on the plunger to make sure all the med is in the barrel. We can take off the blunt-filled needle. This will go into the sharps container. And then again, we'll peel back on our injection needle and attach it. And then we want to recalibrate it to the correct volume back at the 1 ml mark. Okay, so we're at 1 ml, there's no bubbles in our syringe barrel, and I see there's a bleb at the top of the med. So we'll get the two nurses to double sign and double check the medication volume and dose. Okay, so they verified it, they said it's okay to give. And then I also want to verify with the camera, so I wouldn't leave my meds unattended, but for demo purposes, I will to show the camera. So we're at the 1 ml mark. And there's no bubbles, and there was a bleb at the top. And then we can create a label for our medication. So we have nursing Jake, hydromorphone, subcut, 2 milligrams. Our volume is 1 ml. The concentration is 2 milligrams per ml. The date is March 10th. The year is 2022. And the time is 2015, and I'm signing with my initials and credentials. Okay. Again, I wouldn't leave my meds unattended, but I do need to show the camera my label. So we have all the information on the label. And then we can proceed with doing our second med check. So we have nursing Jake, hydromorphone, and on the vial we have hydromorphone. 2 milligrams is our dose. The concentration is 2 milligrams per ml, and on the vial it says 2 milligrams per ml. Our volume we have drawn up in our needle and syringe is 1 ml. So I'm verifying we have 1 ml, no bubbles, and we have a bleb at the top. And the date is March 10th, 2022. March 10th, 2022. The time is 2015. So we can give for 2030 as it hasn't been signed off on yet. And then we have, it's a subcut med, subcut. And on the vial it says SC for subcut, so we know that this is the correct medication. So now that our second check is done, we can put the vial back into the narcotic stock supplies. And we'll begin to prep everything that we need to take to the patient's bedside. So we'll bring a cotton ball, we'll bring an alcohol swab, we'll bring a pair of clean gloves. We'll bring a pencil for documenting, but typically in a hospital we'd be using a black pen. Just for demo purposes, we'll be using a pencil. And then we'll bring our medication cards. Okay. So we're going to bring everything we need to the patient's bedside. So I'm going to first, when I enter the room, I'll do hand hygiene. I want to take a look at the patient's room, make sure everything's safe. The patient is at the lowest level of the bed, and the call bell is in reach, and in my general survey, the patient's not in distress. So I'm going to introduce myself. My name is Tiana Rogers. I'm a student nurse at the University of Manitoba. I'm going to be giving you an injection today. Can you tell me your first name and your last name? Nursing Jake, and your date of birth? January 1st, 1960. And Jake, do you have any allergies? No allergies? Okay, I'm going to double check with your armband here. So we have nursing Jake. Fin is 312654987, 312654987. Date of birth is January 1st, 1960. January 1st, 1960, Dr. Skills Lab. And there's no allergy bracelet, so we know that this is the correct patient. And then we'll go back to our bedside. We'll do our third med check. So we have nursing Jake, and we just verified we have nursing Jake. Hydromorphone, we have the correct drug. 2 milligrams is our dose. Concentrations 2 milligrams per ml. So we have 1 ml for our volume. We'll verify we have 1 ml. There's no bubbles, and we have a bleb at the top of our needle. It's subcut. BID, it's March 10th. We're giving for 2030 because that's not signed off on yet. March 10th, the year is 2022, and it's currently 2015, so we can give for the 2030 time frame. And I've signed with my initials and credentials. So our third check has been completed. We do want to educate our patient on this medication we're giving. So Jake, we're going to be giving you a drug called hydromorphone. It's an injection that is going to go into your abdomen. This is for the relief of moderate to severe pain that you had said you were experiencing. Some side effects may be confusion, dizziness, headache, so just be careful when you're switching positions. We've already assessed your vital signs. We've assessed specifically your respiratory rate. It's above 12 breaths a minute, so we know that this medication is safe to give. We've also done a pain assessment on you, and we've assessed the severity, the location, the quality of your pain, and we know that this drug will be effective. We'll be continuing to monitor your vital signs and pain levels after we administer this drug as well, just to make sure it's been effective and to make sure that your condition is remaining stable. Jake, do you have any questions about this medication? Is it okay if we give it to you? Okay, so Jake has given us consent. We can go ahead with administering this medication. So I'm going to do hand hygiene, and we'll put on a pair of clean gloves. So for landmarking this injection site, we want to be doing the injection 5 centimeters away from the umbilicus, either to the right or to the left works. But we also want to inspect the area just to make sure there's no areas of bruising, and if there is areas of bruising, picking a different site other than that area that had the bruises. So I am assessing Jake's abdomen here. It looks like there's no bruising that's present, so we're just going to pick the right side of the abdomen, and we'll do 5 centimeters away from the umbilicus. We'll take an alcohol swab, and we want to cleanse the area, starting inwards and doing a circular motion outwards. And we'll do that for 30 seconds. Okay, and then we can just throw that into the garbage. Now when we give this medication, we're going to be bunching up the skin. I'm going to stabilize with these 2 fingers, and then we'll inject at a 45-degree angle. So I'm bunching up the skin right now. I'm injecting at a 45-degree angle. I'm stabilizing it while I bunch. I'm injecting the medication, removing the needle, and then I can release the bunch. We'll put a cotton ball on that injection site, making sure we're not massaging the area, just keeping that cotton ball just right on that injection site. We can activate the safety mechanism, and this can go into the sharps container. And then I can remove my gloves, we'll put them into the garbage, and I'll do hand hygiene. And then I want to document that I did give this drug to Jake. So I'm going to sign TR 2015, and I'm signing UMSN 2. And I'm going to show the camera that I did document that I administered this medication. So we have TR, the time is 2015, and I signed UMSN 2. Okay, so Jake, we did administer this medication to you. We're going to evaluate the outcomes in about an hour. I'm going to come and we'll take your vital signs again, make sure your respiratory rate is continuing to stay above 12 breaths a minute. I'm also going to do another pain assessment. We'll again assess the severity, the location, the quality of your pain, just to make sure that this drug has been effective for you. Do you have any questions about that? Okay. So I'm going to do a safety check. The patient is at the lowest level possible of the bed. The call bell is in reach. Jake, if you have any questions, you can just ring that call bell, okay? Okay, and as I exit the room, I will do hand hygiene and exit.